matters here. CAQH, which stands for the Council for Affordable Quality Healthcare, has been around for over 25 years. Most clinicians and practice owners know it as the portal where you maintain your credentialing information. You enter your license, your training history, your liability insurance, your practice address, and all of that data gets shared with insurance plans that you authorize to access that data. And the idea is that you enter it once and it flows out to multiple payers rather than filling out the same information over and over again for each insurance company separately. I remember before CAQH was a thing, we had very thick application packets that had to be filled out by hand for each individual insurance provider. So the idea was this is a way for those providers to verify that information without having to have each provider fill out that large packet of information. And for a long time, CAQH operated as a nonprofit. It was originally created by a coalition of health plans to streamline shared administrative processes, and it became an essential piece of infrastructure for the industry. Most of us in practice have had to use it whether we loved it or not because so many insurance panels require it as part of their credentialing process. Credentialing meaning the way that someone becomes in network with an insurance provider. So that is the foundation. CAQH has been a nonprofit utility that providers enter data into and insurers pull from to manage credentialing and provider directories. In fact, providers every 90 days have to do what's called a reattestation, which they go in and verify their information for this directory. Now, the change in January 2026, CAQH announced that it was no longer operating as a nonprofit. Instead, it became owned by a consortium of 12 shareholder companies affiliated with the nation's largest health plans. We're talking about United Health Group, Centene, Aetna, Elevance Health, Cigna, Humana, and several Blue Cross Blue Shield plans. The official framing was that this new structure would allow the organization to invest more aggressively in technology, deepen partnerships, and accelerate product development. The CEO at the time said the goal was to reimagine the data infrastructure behind care so the system works better for everyone. And if you pause a moment, what this means structurally is that the organization providers are required to submit their data to is now owned by the very insurers that data gets shared with. That is worth sitting with.